come back home. Construction of an infectious disease treatment center at the Korle-Bu Teaching Hospital has stalled after workers abandoned the site. JoyNews' visit to the premises reveals key electrical work is yet to conclude. A foreman told my colleague Daniel Dazi the plastering and other finishing works have been held up. For that reason, the facility was scheduled to be completed 30 days after work commenced nearly 10 months ago. This has left the 8-bed treatment facility at the nation's premier referral center overburdened as Ghana's COVID-19 case count rises. Daniel Dazi reports.
Soon after Ghana recorded its first few cases of COVID-19, it was announced that a 50-bed infectious diseases facility was being constructed here at the Korle-Bu Teaching Hospital. Close to a year after construction began, this facility is yet to be completed. This is contrary to announcements by authorities then that it would take 30 days for this facility to be finished, so it would help in the fight against COVID-19 in the country. As the number of positive cases in Ghana begin to hit 200 per day, the attention of the public has been drawn back to this facility, which is far from complete. So where I'm standing currently is the doorway for the main entrance to the facility. Some of the plastering has been done. You can see there's space there for some of the electronic fittings in there. But you walk inside and you realize that a lot of the plastering has not been done. Now, we've been speaking to some of the workers who are here. They tell us that the crew of workers who were supposed to wire the facility came to work on the 24th, went on break, came back on the 1st of January, went on break, came back on the 7th of January, and that's the last time they reported. It's expected that they will come back to work sometime this week, and after that, after they are done with the wiring, then the plastering for the inside can be completed. There's also the roofing, which has not been completed in the inside. As you can see, the ceilings have not been fitted in. Again, we are being told that the workers who are in charge of this part of the work will do their work by this week so that the construction can continue. The empty spaces also for the doors indicate that there's still some work to be done there. We are being told that the doors are being constructed off-site, and they are waiting for those contractors to also bring in the doors so that they can fit them in. So that was the main entrance, the main arrival hall or the reception. These look like bathrooms to an untrained eye. You see the plumbing fittings in there. There are a number as well here, a number of cubicles in here. You can see this space looks like, a space for sinks. And in there, looks like space for WCs in there, about 4 of them. So, all in all, this is a facility that when operational should be able to really serve the general public. You can see there, unfortunately, some of these iron rods are rusting. It's been a while since they were planted there, as you can see. So we are looking through to really be able to report to you the extent of work that has been done here at the infectious diseases facility, which is part of the Korle-Bu Teaching Hospital complex. This is a 50-bed facility which has been on the books for close to a year at least when the construction officially began. When we visited here in March, the field was being cleared for the construction itself to begin, and it was expected that it should be finished in some 30 days or in the shortest possible time. Remember, more than 50,000 positive cases of COVID-19 have been recorded in the country since then, and this is a key weapon in the arsenal of government in the fight against this disease. We are speaking to some of the supervisors for the gang of workers here. They are confident that within a month all of this work can be done, but then again they are unsure that the requisite funds will be released in time, and also that the workers will return to site so that this facility can quickly come be operational and help in the fight against COVID. As you can see, it's much larger than the current facility, which is seen to COVID-19 patients, which is full. It's an 8-bed facility directly opposite this one. And currently, doctors there tell us that it is completely full. And they are currently treating the average of about 20 patients every single day. Most worrying about it is that 2/3 of the number of patients they treat there, according to our sources, are medical personnel, that is doctors and nurses, who are working on the front line in the fight against COVID-19 in the country. Hospital authorities did not speak to us, but we have sources who are telling us that as soon as the doors are done and the wiring is done, this is work that can be completed in the shortest possible time. The question remains about the funding that must be released from the Ministry of Health, which would, of course, be the agency acting on behalf of government to ensure that this work is done in the shortest possible time. They were unable to tell us why the work has delayed from March 2020 till now, where so many lives could have been saved, so many persons could have been treated if this facility was complete. For Joy News, this is Daniel Daze at the Korle-Bu Teaching Hospital.
And right here in our studios, I'm Bernice Abubeidulansa, and this is Joy News Desk.